So good afternoon, everyone. Welcome to Member Cafe. My name is Ann Gluff, and I am part of the member engagement team. So glad that you're here with us today. We're going to wait just a moment, let everyone get logged in before we start our session today. All right, our numbers are still going up. So again, my name is Ann Gluff. I am with the member engagement team here at Partners Health Management, and welcome to Member Cafe. We're waiting just a moment till everyone gets into our session before we get started. All right, so let me go ahead and get started. Beth is going to be pulling up some slides for us in just a minute. But while she does that, again, my name is Ann Gluff, and I am part of the member engagement team here at Partners Health Management. And joining me here today, also part of my team, is Beth Brooks. She is our behind the scenes Zoom guru. She's always keeping everything running nice and smooth. We also have Lindsay Green. Lindsay is part of our team as well, and she is going to be entering some information for you all into the chat. Um, I want to let you know that the chat during this session, you will not be able to chat in because we are chatting out to you, and we want to keep that channel open. But you will have the Q&A open, the question and answer part as we move forward. All right, so while Beth is pulling up the slides, let's just go over a few housekeeping items. So first and foremost, I want to let you know that our session is being recorded today. So if you do come off mute or enter a question into the chat, please be mindful to keep your personal information close to you. We don't want to share anything that we don't need to share. You can always reach out to our member engagement team if you have additional questions when we're finished talking, and we'll be glad to support you in that. And we're going to provide an email address towards the end of our session that you can send us an email and a phone number as well. We are offering this session today in closed caption. If you don't need this feature, it's automatically there. You can, but if you want to turn it off, at the bottom of your screen, you can simply hover over the live caption and click hide subtitles. Let's see, what else do I need to tell you? Again, you can use the Q&A. That is also should be located towards the bottom of your screen. Usually it's right next to the chat, looks like a little bubble, says Q&A on it. And anytime during the session, if you want to ask a question, you'd want to pop it into that Q&A. We'll moderate those questions. Beth's going to do that for us after our guest speakers. So one last thing everyone always asks, are you going to share the slides? And yes, we are going to share the slides. So we will do that after the session. You'll get the slides. And also the recording is going to be posted on our website. It usually takes about 7 to 10 days to get that recording posted, but it'll be there for your reference. All right, so I am super excited today to introduce our first guest speaker. So you may know that October is National Down Syndrome Awareness Month. This is something that is just absolutely near and dear to my heart. So I am so excited to introduce to you our first guest speaker. His name is Jesse Fowler, and Jesse is a North Carolina native and an active community volunteer. He currently resides in Raleigh, North Carolina with his family, and he serves on the North Carolina Down Syndrome Alliance's board of directors as a self-advocate. He also volunteers as a patient guide at Rex Hospital and at a local food bank. Jesse enjoys helping others and finding ways to remain involved in his community and social groups. He is often described as a positive influence on those around him. So, Jesse, I'm going to let you take it away. I also want to let Well, know that Emma Wisnick is here with him as well, and she is joining him on the screen. So take it away, Jesse.
Can you say next slide, please? No, just tell them. Say next slide, please.
The next slide, please. My name is Jesse Fowler. I am 38 years old. I was born and raised in North Carolina. I love to travel. I've been to Jamaica, the Dominican Republic twice, and to Mexico. I like to watch the ECU pilots play football. I was a cross country runner. I like to bowl in a bowling league. I also have Down syndrome. Next slide. What is Down syndrome? Down syndrome means I have the copies of 25 chromosome. Roughly half of the children born with Down syndrome have a heart condition, often needing surgery. Was lucky and did not have heart surgery. Down syndrome impacts people differently. And individuals with Down syndrome usually need a lot of therapies to grow in maintain
Skills.
maintain skills, but it does not mean I can not do things. Next slide.
No, you're doing great. There we go. Okay.
I grew up around my cousins. We went to the beach and to Kerr Lake and camped a lot. We are very close. We like to build sandcastles. They always treated me just like one of them. I went to Riverside High School and I went to Durham Technical School for 2 years. I'm majored in business. Next slide. I, I also volunteer at the food pantry. I am on the board of North Carolina Down Syndrome Alliance at NCDSA. I advocate for people like me. Next, I, I began volunteering at Rex Hospital Cancer Center in 2022. I greet and escort patients to their appointments. I mentor a boy named Gavin who also has Down syndrome. He is 11 years old. I help him to set and meet his goals. We have worked together a long time. Next slide. I am helping NCDSA with money for the Buddha Walk. I have a team and I am in charge of grading and our T21 to tent.
Great job.
Next slide. I work at Durham Stage Club. I was in the warehouse stocking items and delivering parts for chairs. My goal is one day work. When I'm in middle schoolers, I like working with kids. My grandmother had a daycare growing up, and I helped her and learned a lot. The next slide. I participated in the Special Olympics for 14 years. I also compete in the bowling league. Next slide. What you can do, I like to support people with Down syndrome. It makes me feel good about myself to volunteer. Or you can help people with Down syndrome with their goals. Teach people to respect all their peers, treat them like their age, pursue competence, give me a chance to show you what I can do. Next slide. I have a good life. I love my life. Having Down syndrome does not make my life any less great. Having Down syndrome is only one piece of who I am. Next slide. I guess see that.
No, you want me to read it for you? Emma, you want to read it?
Sure, I can read it for you.
Thank you, Emma.
Now I want to share some about NCDSA. NCDSA is North Carolina Down Syndrome Alliance. They offer programs like teaching about clubs for teens and adults, serve shelves for siblings of people with Down syndrome, welcome baby bags, gift baskets for people who are in the hospital, summer camp, advocacy, mental outreach, virtual speaker series, annual conference, and new UNC Down Syndrome Connect. Playdates with resources and family navigator, monthly retreat, and World Down Syndrome Day classroom kits.
NCDSA serves the interstate of North Carolina. Some things are in person, but some things are on the line. They care a lot about people with Down syndrome like me. You can visit the website at www.ncdsalliance.org. Next slide. This is my friend Emma. Does anyone have any questions about my life, my friend Emma, or NCDSA? Next slide.
That's it. Now we just wait for some questions.
All right. Beth, are there any questions in the Q&A right now for Jesse and Emma?
We do not have any questions yet, but please feel free to put your questions in the Q&A, or or if you think of a question, please raise your hand and we can unmute your mic.
So I have a question for Emma, and Jesse. I got your names mixed together, didn't I?
Okay.
So I liked your list of things that the ND National Down Syndrome Alliance of North Carolina does. And one of the things that caught my eye was that you did classroom kits for World Down Syndrome Day. So what do you provide in your classroom kit? Do you all know?
So
I know.
I'll take this one. I'm just over here a little bit. I'm Amy. I'm the executive director at NCGSA. And Emma's one of our team members. The reason she's not sure is because this is new this year. It'll be the first time that we're doing these World Down Syndrome Day classroom kits. They're going to be free and available to schools across North Carolina. They'll include things like a book on inclusion that's geared towards elementary school age children. It's really all about asking respectful questions, not being afraid to engage, but let's just embrace it and ask those questions openly. There'll also be lesson plans for teachers to help engage their students in conversation about people who are differently abled, and how do we have those respectful conversations and dialogue, and what does it mean and what can they do. We also are going to have some craft opportunities for the classrooms to engage around that. And then we're going to have some token items for the students to take home that might, relate to perhaps crazy socks that we wear on 3/21 to celebrate Down syndrome. But we are excited to put those kits together, and that's something new and exciting. And Emma will be learning all about that in a few months.
Very good. I love that idea. Can you share with us how a teacher or a school might request that information? Maybe we can share that information in our chat so we can
Yes,
share it.
so that's all be available on our website, which is ncdsalliance.org. So as we get closer to March, then I would definitely keep an eye on our website where you'll be able to just submit a form. Again, it will be free of charge, sent out across the state, and available to classrooms. And I think that's really important. I have 3 children, all who are neurotypical. None of them have Down syndrome, but my children have learned so much by having exposure to diversity through my job here at NCDSA.
Mhm.
They go to a private school, so they haven't been around children who are differently abled. And without question, my daughter has learned more and gained more from her interactions here in such a short time frame than she ever has in other environments with children who are like herself. And that's been amazing for me as a mom, and really was the impetus behind we've got to do these classroom kits that increase that inclusion and exposure.
Right. Nice. Thank you very much for sharing that information with us.
So we do have some questions. So I'm gonna go run through those, and then we've got a couple of comments. So what is your favorite part about participating in NCDSA?
That's a very good question. Well, I like being with Betty Johns. He's one of our staff here, and she's so bubbly, so happy every time she comes in. We're working on Tuesdays, and it's just a lot of fun.
Very supportive.
Yeah.
What's your favorite part, Jesse?
So my favorite part is being as a board member. I've met a lot of people. It was very nice here.
Awesome, thank you. And then somebody said you both did a wonderful job on that
Oh.
presentation.
Thank you.
Thank you.
And then the next one is, Jesse, how do you support the 11-year-old boy that you mentor, and how have you helped him?
So his mom worked for Wakefield. You will see Rex Cancer Center here in Raleigh. So I met him through her a few years back. So I'm helping him like his on his goals, and like helping him have have respect for people as well.
Very good.
Hey, Ann, you want to turn your camera off and right back on?
Yeah, I just noticed that. That purple hue. My camera does that to me sometimes. So let me see if I can fix that. There we go.
Very good, thank you.
Mhm.
So the next question is, when did you say these kits would be available?
So those kits will be available. We're hoping to have them ready in February and sending out no later than early March, because March is when we celebrate World Down Syndrome Day. It's 3/21 for that 21st copy, or the 3rd copy of the 21st chromosome. And so we will have those ready to go out then in March. Yes, we're very excited about that. And we were very grateful to have a grant from the Carolina Hurricanes that are funding that project for us.
Nice.
Awesome. Will preschoolers be eligible for the kits?
We certainly could do them for preschools. Absolutely. I don't see why not. The book is appropriate for that age level, and I'm surrounded, my team here are almost entirely teachers, so they're excited and looking forward to putting together those curriculum guides, and we're going to intend to target that for young age groups as well. So that's certainly something we can do.
Nice.
Absolutely. And if there are any questions as well about supportive employment and how we help to support Emma and Jesse in their roles here, I'm happy to answer any of those questions that may come up as well.
So we also, Reese had a question that when is the annual conference and who can attend?
Absolutely. So our annual conference this year will be April the 12th. And it's at Alamance Community College. Anyone can attend. You don't have to have Down syndrome or a loved one with Down syndrome. You might just want to learn more about the diagnosis or ways that you can help and get involved. We have educators who attend. We have families who attend. We have medical providers who attend. So it's a great opportunity to learn more about that diagnosis, what it might entail, and ways that you can get involved and support others.
Thank you.
Sure.
Then is there a way we can volunteer to help make kits located in Charlotte? So I'm assuming that means that this person is located in Charlotte.
Absolutely. Well, in Charlotte would be tricky, but we will have opportunities here in the Raleigh area because that's where our training center is located. That's where our materials will be, and we'll be shipping out the kits from here. But perhaps I would say reach out to us on the website because there might be an opportunity as we get closer where, as we have the kits prepared, if someone's willing to make a trip, they could take a large quantity back to Charlotte and help disseminate in the Charlotte area, which would be wonderful and also helps us a lot save on the shipping and then get that personal touch with the classrooms as we're distributing.
Yes.
And then one last question. It says, how do you sign up for them now? So I'm assuming that means how do you sign up to get the kits?
For the kits, we do not have the link up for the kits just yet. We're waiting to get through our buddy walk season, which is our big event coming up on October 20th. Once we survive buddy walk, we can focus on that next step and we'll be thinking more towards those kits and getting those prepared. But I would anticipate we're also changing our CRM system. So I would anticipate very early next year that we'll have a link up and we can start promoting that online. You can also follow us on social media. No question, these will be advertised on our social media as well.
Great. All right, Beth, are we ready to move on to our next guest speaker? All right. Well, Beth is gonna pull the slides back up, and so I am excited to introduce our next guest speaker. His name is Reese Williams, and he has been an athlete with Special Olympics in Iredell County for the past 16 years. He enjoys training and competing in bocce, bowling, basketball, tennis, powerlifting, and snowboarding. Wow, Reese, you are busy. Reese currently serves as a Special Olympics North Carolina Global Messenger and a Health Messenger. And is a past member of the Special Olympics North Carolina Athlete Council. And most recently, he was selected to participate in Dream Ride in Farmington, Connecticut. He is delighted to share his love for Special Olympics with anyone who asks. So Bobby is his mom. She is here with him today as well, and she serves as the local coordinator for Special Olympics Iredell County. And again, something else that's near and dear to my heart, Special Olympics. And I'm going to let Reese take it away. So Reese, you're on mute, so you need to unmute your microphone.
Unmute.
Oh,
Okay,
we
sorry,
cannot unmute.
we couldn't
Okay.
unmute it from our end for some reason.
All right, we
Um,
got you now.
yeah, great. Well, first of all, we just want to thank you for inviting us to participate today and to be on the panel. Reese and I are always eager to share about Special Olympics, and we just hope that anything that we say today might encourage people who are not currently participating to participate in this wonderful program. As a mom of a young man with special needs, I can say that over the years, my knowledge and my opinion of Special Olympics has changed quite a bit. And I am truly thankful for the path that God chose for us and our family a little over 28 years ago. On June 22nd, 1996, my husband and I went to the hospital to have our first child. And what we experienced that day was a true roller coaster of emotions. Reese was born, and we were absolutely elated. And like all parents, we were, you know, in awe and in wonder and in love with this little fella. And about 4 hours after he was born, our doctor came in to tell us that Reese had trisomy 21, or what we all know as Down syndrome. And in that instant, our hearts were broken. And in the days and the weeks that followed, we shed a lot of tears. And I would like to note here that these were the days before Reels and TikTok and social media. And so seeing all the cute, wonderful stories that we get to see now, we didn't see that. Our knowledge of Down syndrome was limited to what we had seen at school in the 70s and 80s, which tells you that we're really old people. Up until Reese's birth, I had really only known one person with Down syndrome, and her name was Patty Joe. And she went to my high school, but I only saw her one time a day. And that is when she was passing my classroom with her classmates on the way to the lunchroom to pick up her lunch. And then they would just return to their classroom, and we did not interact with them and we did not see them the rest of the day. And I would occasionally see her out in public, and I always thought she was fun and kind of spunky and a little bit sassy. But I also wondered, what does she do outside of the few times that I saw her, and just kind of wondered about her life a lot. So anyway, we knew so little, and in that moment that Reese was born, we were hurt and we were grieving and we were very worried. We were also very much in love with this boy. And we also knew that our families would love him and cherish him. But as a mom, I just could not shake the thought that no matter what we did as his parents or as his family, that other people might not accept him. And I spent a lot of time imagining what life would be like for him at school. And the recurring thought that I had was of him being on the playground at school, sitting by himself and not having anyone to interact with. And I worried a lot about other kids picking on him. And I can remember being out in public and people making comments about, someday Reese will do Special Olympics. And I honestly felt angry with that. And these are just my raw feelings at that time. And I can remember just saying to them, don't underestimate my child. And what I had no clue about was that I was the one that was underestimating. And that is one of the things I look back at and truly regret. If I had my way, Reese would have not been in Special Olympics. But I had a mother-in-law who was determined that he was going to be in Special Olympics, and I thank the Lord for that all the time because she is a much wiser woman than I will ever be. And so she took Reese at about 7 years old and she trained him for our spring games to do the standing long jump and the softball throw and the 25-meter run. And he really, really did a great job. And from that point on, we were hooked on Special Olympics. And on those days that we spent crying and worrying and picturing that sad scene, if we could have just seen a glimpse of what Reese's time was going to be like in school and in Special Olympics, if we could have seen even only a fraction of what he was going to gain through his experiences, we would have known that all that stress was useless and all those tears were just absolutely wasted. If I had known more about Special Olympics and how much these athletes are valued and how meaningful their experiences are, I would not have hesitated for a second to have Reese involved. And so I know looking back that I'm the one that underestimated the worth of this program in those early days. And I just hope that by sharing that with other parents and other people, that their mindset about things may shift a little quicker than mine did. So I'm going to stop talking because really there's no one better to tell how impactful the Special Olympics experience is than the athletes themselves. And so today I have my favorite athlete with me, and that's my son, Reese Williams. And so, Reese, to tell you a little bit more besides just his experience with Special Olympics, currently, he's also attending Mitchell Community College, and he also works at Village and Pizza, and he helps out a lot at our church. And he is a uncle to our brand new baby boy and is doing a great job with all of those things. And so I'm going to turn it over to Reese, and he's going to share with you his experiences.
Hi everyone, I'm Reese Williams, and I have been involved in Special Olympics for the past 17 years. As my mom said, I started out participating in spring games at Stetchville High School. From there, I learned about the swim team and started training and competing in swimming. I started off doing the walk in the small pool and wearing a flotation belt during the 25-meter freestyle. But now I am swimming a 100 freestyle and backstroke. Each year, my love and involvement in Special Olympics grew and grew. Over the years, I have trained and competed in basketball, bowling, boxing, alpine skiing, snowboarding, sailing, tennis, and powerlifting. That's right, I am a champion on land, snow, and sea. I have earned more than 35 gold medals at the state competition, as well as lots of silver and bronze medals. I am a trained Special Olympics North Carolina Global Messenger and Health Messenger, a member of the Special Olympics North Carolina social media team, and have served on the Special Olympics North Carolina Athlete Council. Most recently, I was selected to attend Dream Ride in Connecticut with athletes all over the world. Now, I know some of you are thinking, wow, this dude is impressive, but I want to tell you that what is more impressive than all the medals and titles is the skills I have learned. Through Special Olympics, my life has been impacted on the most positive ways. First, Special Olympics has taught me to set goals high and to work hard to reach them. My cousin Rob Williams was an athlete with Special Olympics. He won over 65 gold medals and participated from the local level all the way to War Games. My goal from the beginning has been to win as many gold medals as Rob and to carry on his legacy. I know that those gold medals require hard work. I am a competitor and I want to win, but I also want to improve. My coaches help me to improve my skills and help me advance in each sport I do. I stay physical fit and fully engaged in all year long. Now you heard me say I am a competitor. Actually, what I meant to say is that I'm extremely competitive and I don't just want to win. I want to win bad. Let's just say that the next thing I learned through Special Olympics is how to be a good sportsmanship. I have learned how to win and lose gracefully. As a Special Olympics North Carolina Global Messenger, I have had the opportunity to speak at many events across the state. Going through the training to become a global messenger gave me the skills and confidence to speak in front of any group. Over the years, my public speaking skills have improved. I have been given the opportunity to share my love for Special Olympics with donors, volunteers, athletes, and so much more. For 2 years, I served on the Special Olympics North Carolina Athlete Council. I think this has made the biggest impact on my life. To be selected to serve on the council, I had to complete an application and go through 2 interviews. Also, for the first time in my life, I had to go to weekend meetings near Raleigh, North Carolina, without my parents. My mom would meet our advisor, Sherry Paul, on Friday mornings in Winston, and Miss Sherry would drive me to Morrisville for the meeting. We would spend the weekend in a hotel, and sometimes I had a roommate, and sometimes it just me. During these weekends, I experienced true independence for the first time in my life. Let me just say, I loved it. My mom, not so much. She had a lot of growing to do in this area. As a council member, I am responsible for helping train new Special Olympics coaches. Twice a year, I help with these important trainings to help our new coaches understand how to work with people with special needs. I have learned to be an advocate for our athletes and for myself. This also led me being a Special Olympics North Carolina health messenger. As a health messenger, I assist the state staff with healthy athletes and methods at state level events and serve as a co-MC for It's So Good virtual workouts. Being a health messenger, I also motivates me to watch my diet, to exercise more often, and to be aware of my mental health as well. Special Olympics encourage me make my overall well being a top priority. Excuse me. Through all these experience, I have built meaningful relationships with my fellow athletes, coaches, and volunteers. We are part of community and a family. My social life is busy, and I know that there are people who really care about me and I care about them. As you can see, Special Olympics is so much more than sports. As, you, as an active participant, I am developing leadership skills, improving my communication skills, gaining confidence, and becoming more independent. I have gained valuable relationships and enjoy a lifetime of engagement. I have moments when I have to be brave and show lots of courage, and I always feel empowered and valued. Thank you for your attention. I hope to will join Special Olympics.
Thank you so much, Reese. I absolutely love your enthusiasm for competition. Sounds like you are really wanting to be a winner. And it
Yeah,
sounds like you are a winner. So I love that you shared how Special Olympics is much more than sports. Because as a mom, I find Special Olympics is very much a community. Not, definitely for you, Reese, and all of the friends that you have. My son receives the same thing, but I also feel that it's a community for parents and families. It's an opportunity for moms to talk to moms, dads to talk to dads. It's a natural support. So it's really, really, really nice. So any questions, Beth, that we have waiting for Reese and Bobby?
We do. Someone says, "Oh my goodness, thank you for sharing such intimate and insightful details of y'all's lives." And then the next one is, "So cool to hear story of independence. Also very relatable." And the next one is, "Reese, you are an impressive athlete, messenger, coach, and council member. Which is your favorite sport?"
my favorite sport is tennis and powerlifting and bocce and bowling too.
He likes them all. Hard to pick a favorite, isn't it?
Yeah.
Yeah.
And that's all the questions that we have. Does anybody want to open their mic and ask Reese or Bobby any questions about Special Olympics? Or you can put them into the Q&A and we will go through them. Okay, so here are a couple questions coming in. Bobby, what were your reservations getting Reese involved?
I think my reservation really just stemmed from lack of knowledge. I didn't know a lot about Special Olympics. Where I grew up, I don't remember any anything happening with Special Olympics. Um, and so I really honestly don't know what my reservations were. I think it was just that the stigma that was attached to people with special needs at that time. And I can honestly say that, we've watched that evolve and we've watched that mindset turn around completely. I'm really thankful for that. And like Reese said about me having to let go of him and let him have some independence. I had a lot of growth in that area, and I also had a lot of growth just in the area of understanding people with special needs. And so to pinpoint what my reservation was, I don't know, except just simply lack of knowledge, I guess. Yeah.
Thank you, Bobby, for that very
Mhm.
honest answer. How would somebody sign up for Special Olympics?
So each county has a Special Olympics program, and they all do different things. We're all headed in the same direction, but each county offers different sports and different activities. But one of the easiest ways for you to get involved is to use your county name. So like for us, it's Iredale, and then at sonc.net. So whatever the county name is, at SONC, Special Olympics North Carolina.net. And just send an email and just say, hey, I'm interested. I want to get to know more about what you offer. It's always a good idea maybe to talk about the age of your child, because we do have programs for children that are ages 2 to 7. That's the Young Athlete Program. And then children at 8 years old can actually start to train and compete. And there is no upper age limit. So if you have a child that's between 2 and 7, make sure you make a note of that so they know what to give you information about. And most counties also have a Facebook page. And so with that, you would put Special Olympics and then the county name. You can also visit Special Olympics North Carolina.net and learn a lot of information from their webpage.
Thank you, Bobby. And then the next question is how to find out about local buddy walks. So the buddy walk for the greater Winston-Salem area will be this Saturday at West Forsyth High School in Clemens.
And
Yes,
the buddy
there are a
walk,
number of different. Sorry, go ahead.
the buddy walk for the Down Syndrome Association of Greater Charlotte is on Saturday, October 19th, and it will be at the Cannonballers Ballpark in Kannapolis. And then I think that yours, Amy, is the following day on the 20th. Is that right?
Yes, ours is on the 20th. There are a number of localized Down Syndrome Alliances or DSAs throughout North Carolina, and several of them have buddy walks, as you mentioned. Ours is on the 20th. The 19th for Charlotte. Western Down Syndrome Alliance actually just posted while we were on the call that they have unfortunately canceled their buddy walk because of the devastation in Western North Carolina, and the park where it's hosted was unfortunately destroyed. So definitely thoughts and prayers for them right now, and we're looking into ways that we can help support them. The Coastal Buds, which is the Wilmington area, held their buddy walk last weekend, so theirs has passed. But there are several more in the area across the state. I would just encourage you to look at your DSA or reach out to us if you have questions. We're happy to look that up for you. But there are a few more still going. We're still full force in October, and you can't necessarily see it all, but we are covered in buddy walk gear all around us right now.
Does anybody have any more questions for either Reese, Jesse, or Emma? Okay, somebody has raised their hand, so I'm going. Oh, I thought they raised their hand.
Yeah.
What is it?
Yes.
Okay. If you think of any questions, please feel free to go ahead and put them in the Q&A. And then Anne, I have moved our slides. Is there a particular slide you want me to start with?
would be helpful if I unmute. I think we have about 10 minutes. Is that right?
It is.
I think if just go ahead and start with our first slide.
Okay.
So I want to say thanks again to our guest speakers. Y'all have shared some just wonderful information about getting involved, and Jesse and Emma, what you're doing with the council and other jobs that you have. So really great to hear. So now I'm going to share a little bit of information with you all about Partners Health Management. Emma asked, who is Partners Health Management, when we were getting ready to go on air. So Emma, Partners is what's called a local management entity managed care organization, which is, you know, a lot of words there. And we're basically an insurance company. We're a specialized health plan, and we manage Medicaid dollars for the state of North Carolina. So there are 3 other companies just like ours across the state. And what you see right here is the tailored plan just went live July 1st. And the tailored plan is a specialized health plan for Medicaid. And what's special about it is that we do focus on supporting individuals with needs in intellectual and developmental disabilities, with severe and persistent mental illness and substance use disorder. And so that's what our focus is. We do the tailored plan. It covers the whole person, being that it covers physical health as well as the behavioral health and services and supports for intellectual and developmental disabilities. And so if we go on to our next slide, this is just a view of the Medicaid or the member ID card. We show this because it looks a little different than what people have been used to with having their Medicaid ID card. In the past, it's been more of a paper card that's long and narrow, gray in color usually, that comes from your Medicaid off your Department of Social Services. So this is more like a kind of a credit card size, and it gives you all of the information on the front, your name, your Medicaid ID, who your primary care physician or your doctor is, and their office and maybe contact information, as well as information that the doctor's office needs. And then on the back of it, several phone numbers that can be used by the individual themselves. And I'm going to share more on the next slide about the phone numbers that are on the back of that card. So these, what you see on the screen now, are all the ways to connect to Partners Health Management. And so in that very first row, if you're a person that wants to remember only one phone number, this is the phone number that you need to remember. So it's 1-888-235-4673. And that number takes you into Partners, and it's going to be answered by our Access Call Center between 7 a.m. and 6 p.m. Monday through Saturday. You're going to get a menu, and you can select the option that you need. If you're not sure who to talk to, select Member Services. We also have a behavioral health crisis line that is open 24 hours a day, 7 days a week, 833-353-2093. This line is answered by licensed clinicians, and they are there to help you through a mental health crisis, a behavioral health crisis, either for yourself or maybe someone that you're with, and they're going to help you get connected to support and service that you need. Next is non-emergency medical transportation, also referred to as NEMT. So those who have Medicaid and the tailored plan in particular can get rides to their doctor's appointments, to the pharmacy to pick up medications that you need. And that number that is there on the screen, you can also access NEMT through the main Partners line, 888-235-4673. There's also a nurse advice line for our tailored plan members. That's one of the other numbers that's on the back of your ID card. That nurse advice line is open 24 hours a day, 7 days a week, and they're there. You can call and ask them questions. Perhaps you're not feeling well, getting sick. and you're not sure what to do, they can help you with that. You can ask all different types of medical questions, maybe about a medication. We also have a pharmacy services line, 866-453-7196. They are also open 24 hours a day, 7 days a week for tailored plan Medicaid members, and also providers can call this line. Next is something that is new to Medicaid this year, Teledoc. You can utilize Teledoc and do an online visit with a doctor. One thing I want you to know is that you need to register ahead of time online before you can access this service. And you can see the Teledoc, that's hard for me to say today, Teledoc Health. And Lindsay, if you could pop that link into the chat, that would be great. And that's where you go to register prior to using Teledoc. And that last number is provider services. So I know we're running out of time here. So let's see what we have next here. Partners Health Library is a great library that you can access online through our website. It's going to give you some great tools to learn more about a health condition, or just look for information about any health topic that you really can think of. It's a great online tool. And so our next slide is Member Connect. This is our member portal. So you yourself, if you're a member of the Tailored Plan or Medicaid Direct, or you're a state-funded recipient, you can set up a login for your Member Connect and see information about your benefits, health plan documents. You can access forms here where if you want to change your tailored care manager or your primary care provider, all of this is accessible through Member Connect. And then let's go ahead and go past that since we're running out of time. Transitions of care. This one is important. I want to let you know that you can transition between health plans. The way Medicaid is now set up, there are health plans, standard plans, tailored plans, Medicaid Direct, and a reason to switch between the plan may be that you have additional needs or services, or you need more benefits than the plan you're currently in. You need to make that change. It also may be that you moved and are living in a different county, or maybe your Medicaid status changed, but you can make those changes. You can reach out to your healthcare provider to help you with transitioning between plans. You can also go to the link right towards the bottom of the screen is a request to move form. And you can also call our North Carolina enrollment broker at 833-870-5500 to get assistance. All right, what else do we have, Beth? Member engagement. That is the team that we are part of. So our purpose, we're here to help you. We're here to help you navigate through the healthcare system, through Medicaid, to get where you need to be. We also provide education and kind of like what we're doing here today, have guest speakers and present information. You'll also see us out in the community at resource fairs. If you have questions for member engagement, you can send an email to memberquestions@partnersbhm.org, or you can call our main line and ask to speak to member engagement. Pix Health mobile app. That is another benefit that we have. It is a app that you download to your phone, and it focuses on mental wellness and really focuses on the epidemic of loneliness. Super great app. So check it out. You can go to www.highpix.com or call the number on the screen there, 855-499-4777. Hope I didn't say too many sevens there, to learn more about the Pix Health app. Stay in touch with us. All right, we are right at time. So this one is super important to stay in touch with us. If your contact information has changed, make sure that it gets updated. You want to call your local DSS office. If your address changes, your phone number changes, And they're kind of the keeper of the information, and that gets shared with us on a regular and continual basis. So just super important to stay in touch with us. You can also, if you're a state funded recipient, to keep your information up to date, you would call us here at Partners. And the next one is Stay Connected. And this is, if you go to partnersbhm.org/subscribe, or if you can grab that QR code on the screen quickly, this is how you can get informational emails and articles from us on a regular basis. And last but not least, your feedback. We love to hear from you. And so it's really important that you share with us how this time went today, maybe what other topics you'd like to hear more about. It's a really short survey, just take you a few minutes. So you can grab that QR code you see on the screen, or you can grab the link at the bottom, and it's also, Lindsay just dropped that into the chat for you. And so that is all we have for you today. So again, I want to thank our wonderful guest speakers, Jesse, Emma, and Reese and Bobby. We truly appreciate you sharing all of the information. And so again, thanks for joining us, and plan to join us next month. Same time, same place, second Tuesday of the month in November at 1 o'clock. And more information will be coming out soon on our topic. So y'all have a wonderful rest of your day. Bye-bye.